Hey everybody, Dr. Rob Silverman here. Facebook Live. We're doing a Saturday special. I am, as always, excited to be here. Got some good stuff to share with everybody out there. This was actually a request from one of my patients. And as you guys all know, I'm a practicing chiropractor. And in my chiropractic approach, I mix the mechanical with the biochemical. So when we talk about ways of coping with sciatica, I believe that my approach is probably one of the more eclectic approaches, and I'd like to share 7 different ways to deal with sciatica for you. Now, Harvard Medical School has about 5. I've added a few, and I think between the two philosophies, I have a molded and melded type of approach. So let's talk about 7 tips for coping with sciatica. Number 1, sciatica, longest nerve in the body, goes from the nerve roots of L4 to S3. Most people really get mistaken when they think sciatica. They think it's just pain in the back or pain in the side of their hip. Sciatica is actually going from their lower back all the way down the side of their leg to their big toe. If it doesn't give you that distribution or nerve distribution, it's actually not true sciatica. Having said all that, most people will want to know about sciatica and think it's sciatica. And I can tell you this, that the patients who have sciatica, it's not a one and done. It's very difficult. And it's extraordinarily painful for so many different patients who have any form of sciatica or pseudosciatica. Now, I've used the term pseudosciatica. The true definition of pseudosciatica is actually a muscle in the glutes or below the glutes in the buttocks region that grabs the nerve, and that's called the piriformis. Now, with that being said about the piriformis, that's a soft tissue release, and I'm going to share all that and what to do about that at the very, very end. Now, most people will say, I want to foam roll sciatica, and I will say no, because you don't want to foam roll on a nerve. You want to foam roll on a muscle. The muscle will open. If you roll and foam roll on a nerve, here's some of the problems. When you foam roll on a nerve, you're actually going to irritate the nerve. And the nerve does not like rubbing and irritation. So that's one of the biggest problems. Hey, can I get in there and can I rub it? You could release the muscle if it's coming from the piriformis, but don't roll on the nerve. So that's not one of the tips. That's an overriding theme. I just bonjour from France. Comment allez-vous? So be careful in your approach to it. So let's talk about what I call the 7 different tips for sciatica. That would be an additional tip that I just shared with you. The first tip is let's consider exercise. Exercise through sciatica. People go, what? I'm like, absolutely. Let's get some exercise. There's aerobic exercises. Now, it doesn't have to be necessarily walking, because if you have real sciatica, you're not going to be able to walk. But let's get moving. Have some strength training and have some flexibility training. That's actually from Harvard Medical School. Second thing is strengthen your core. And the reason that you want to strengthen your core is the stronger that your core is over here, the better your periphery will move, meaning your legs, your arms, and such. How do you strengthen your core? Well, number 1 is that the best idea is to avoid certain things so you don't damage your core. That being spoken about, that would be like a sit-up, a crunch, anything where you bend your lower back. Bending your lumbar spine actually pulls on structures in your spine and damages your lower back. So no sit-ups, no crunches, no leg raises. So to strengthen your core, it's more not necessarily moving your core, it's holding your core in place to allow your periphery to move, like planks, side planks, bird dogs, and the such. And the key to it is actually bracing, 360-degree co-contraction to hold your core in a specific tight area. And you do so by actually pressing in on the sides. Hopefully everybody can see. I'm going to stand up a little. Pressing in on your sides here. And if you feel your sides get really tight, like you're bearing down, you've now engaged your obliques. And by engaging your obliques, you're now able to understand that you have a 360-degree co-contraction. When you have that co-contraction, you're now contracting what we call your intrinsic muscles. Your intrinsic core muscles, actually muscles that hold your core tight, and your dynamic muscles is what allows you to move. As long as you don't have any breaks in your lumbar spine, you will have a precipitous decrease in sciatica. And got a little question here. Do all these after you get treated for sciatica no longer in pain, or do you do these exercises to avoid the risk of sciatica? It's a great question. So number one, number one is you want to brace. You would without question want to brace whether you have pain or not. You work through the brace. So the plank and the side plank, if it's very painful, you're not going to be able to do those. However, you want to do as much as you can up to the point of pain. And that's why a lot of people, I'm not saying you can't do it on your own. That's why you always want to seek out somebody. And I'm a big proponent, as you guys all know, I'm a chiropractor. I'm a big believer in seeing chiropractors. I think that we are so well versed in the spine and the core, and especially with the spine, the core in reference to nerves, I think we're a great starting point. Strength and flexibility training. I think that again, that goes into the core idea. Even though I'm sitting now, you want to avoid sitting for long periods of time. The pressure to your discal material, which may then provide leakage pressure from the disc to the nerve. You want to avoid sitting for long periods of time. There's a couple of reasons why you want to do that. Number one, pressure. Number two, when you're seated, you're tightening what we call our psoas, our hip flexor muscle. And when our psoas, which goes from T12 to L4, not including the L5 disc, gets tight, it provides pressure, and that pressure is to the lumbar spine. Also, by sitting, you shut off your glutes. Your glutes are your strongest muscle in your body, not per square inch. And you start to get, when you have that muscle imbalance, the tight psoas and the shutting off or the absentee of glute firing, you start getting anterior pelvic tilt. So you don't want to sit for long periods of time. Also, seated, most people drive when they're seated, so that vibration also irritates the disc and doesn't allow you to elongate any of your hamstring muscles. For me, another great aspect is to manage your weight. And there's a few reasons why you want to manage your weight. Number one, the heavier you are, or the more fat cells you have, toxins live in fat cells. So the heavier you are, the more fat cells you have, the more toxins you have. Also, the weight throws, when they say your weight's being thrown. So if you're kind of heavy, if you're a male, it looks like you're pregnant, if you will. You've got that, what my mom calls the middle age spread, the beer belly, whatever. That weight, again, causes anterior pelvic tilt. Also, you're more inflamed, everything's inflamed. So people think, I'm just a little overweight. Yeah, but it gets to an exponential inflammatory increase through your body. So you definitely want to manage your weight. You want to manage your weight because it also alters your gait. What they found is 10 people who are even just 10 pounds overweight start to walk in more toed-out fashion or abduction, putting a lot of pressure and have an increased incidence of sciatica. And you do, without question, want to practice good posture. Posture is a critical element. So, when you roll your shoulders forward, that puts some strain on your lower back, etc. Now, some of the things that you don't want to do, I want to revert back to what I said. You do not want to foam roll on a nerve. You want to avoid foam rolling on a nerve. That's one of the biggest things that I can say. I think it's one of the biggest mistakes that people make. Also, in the idea of activities of daily living, you also do not, without question, do not want to put heat on. Most certainly don't want to heat a nerve. Nerve does not like heat. You will be sorry. It may feel a little better for the first 30 minutes, but within 2 hours, it's going to pose an issue. Ice is a much better choice for application to any kind of nerve irritation. Also understand that nerves are interesting. They're kind of like leaky faucets. They take a while to turn on, but they also take a while to turn off. So even if you come in and I give you a good treatment and you only have a 10 to 20% decrease in pain and you're starting to think I need more isn't better. It's going to take a while. It's not like a muscle that can contract and relax. Nerves have what we call volume dials. They elevate and they decrease. So I'd be real careful. One of the other modalities or recommended things I use is low-level laser. So I use a lot, as we all know, of the corneal red laser. I use the laser because it actually stimulates what we call the action potential in a nerve. And I've seen a lot of peripheral neuropathies like sciatica really resolve much quicker because of the application of low-level laser. And now some of the other things, the last thing I would recommend would be a nutritional concept. The typical stuff: please avoid your fried foods, please avoid your sugar, please avoid your gluten, please avoid your dairy. Let's talk about nutritional supplementation. The original formulation that was so effective was gamma-linolenic acid of 360 milligrams and alpha lipoic acid of 600 milligrams. It was without question effective in treating low back pain and sciatica. In studies, that combination group saw significant improvements in the feeling of numbness and tingling in the lower leg. There was a dramatic decrease in reports of stabbing and burning in the lumbar region in those patients who took alpha lipoic acid and gamma linolenic acid. The real takeaway back in 2010, it's 10 years ago, there was no clear evidence that surgery is more beneficial than conservative treatment in the form of gamma linolenic acid, alpha lipoic supplements, plus good low-level rehab. Many people ask, what is alpha lipoic acid? Well, number one, it's an antioxidant that works with the water in the fat part of the cell. It's also a potent ingredient that supports healthy inflammatory response. Getting back to the antioxidant theme, it contains multiple antioxidant properties. It also supports the master antioxidant glutathione levels in body cells. Very important because it is, again, like I said, the master antioxidant, very potent. It's naturally produced in the body and it can become depleted due to aging, poor diet, or sedentary lifestyles. But the real combination that I want to talk about now, and clinical studies really validate this, is PEA and alpha lipoic acid because they work together to promote healthy inflammatory response. So PEA, which is a great pronunciation, I'll spell it for you after I get off the live, is a bioactive lipid. It plays a key role in the cannabinoid system, and it's responsible for promoting balanced systems, including central nervous system and the peripheral nervous system. So it helps promote relaxation and healthy nerve function, and PEA is produced naturally in every cell of the body in the biological response to inflammatory markers. Curcumin. We've talked about curcumin before. Curcumin, which is the colored ingredient in turmeric, actually shown to accelerate injured sciatic nerve repair through reduction of Schwann cells, cell death, and promotes actually what we call myelinization, so that myelin sheath can grow back. So it's a huge takeaway. It's a strong recommendation. So we talked about 7 different steps. Sciatica, if it's true sciatica, could be very difficult. True sciatica also poses a problem in that it's difficulty, it's quite painful, it takes a while to heal. Some of the other things I would recommend as an addendum would be nerve flossing. So I will do a follow-up in a week or 2. I'll let you try this to show you how to nerve floss, and I'll show you not only how to nerve floss, I'll show you how to nerve floss with laser therapy, and I'll show you how to nerve floss at home for sciatica. So it's always been my pleasure. We're going to try and do a few more videos per week. I'm excited about sharing everything with you. It's been my pleasure. Just remember, Dr. Rob, always yours in heaven.